DMX versus MRI. Which is better? Stay tuned and find out. Well, let's talk about that a little bit. The industry standard has always been, if you have a more significant injury, where maybe you've taken an x-ray of the neck and someone's told you it's normal, we can't find anything, what do? They escalate it to have you go do MRI. MRI is a fantastic tool for looking at soft tissue, ruling out things like tumors and severe disc herniations. But there's a couple problems with MRI. One, most of the time it's taken lying down. It's not weight bearing. Okay, in some parts of the country they have upright MRI. That's usually what we would prefer because it's weight bearing, it loads the joint. Usually when you're loaded is when you have the pain or the problem, so that's how we want to image it. So that's one issue with just MRI compared to a different type of MRI. But another thing is that MRI really is only used primarily to look at the disc. And the disc is a very important ligament, but it's not the only important ligament. It's one of 10. So between every 2 bones in the neck and the whole spine really, there's 10 ligaments between each 2 bones. One of those is the disc, the other 9 really get ignored on MRI. In the upper neck, the upper cervical spine, which is called the cervical cranial junction, very, very important part of the spine, there are not discs up there. So MRI doesn't tell you much of anything. So as far as the cervical spine is concerned, MRI is very lacking when trying to look at spinal ligament injury. And we know from the research, from the literature, that spinal ligament injuries are the #1 cause of pain and disability in the world today. So these things need to be diagnosed properly. What's the gold standard for diagnosing a spinal ligament injury? Well, it's a study that includes motion. Has to include motion. You have to move to actually see if something's moving excessively to then derive that the ligaments that are supposed to hold those bones together are compromised. That's how you figure out spinal ligament injury. It's not on MRI, it's not on plain film, static, holding still x-ray, it's not even on CT scan. It's on a dynamic movement study, which the best thing out there to date is DMX, digital motion x-ray. This works with other joints as well. You can do wrist, elbow, shoulder, jaw, the TMJ. There's things, shoulder is very expansive. There's multiple joints in the shoulder. This can be done in the hip, the knee, ankle. So all types of parts of the body where maybe other studies don't find anything and you're still having pain, disability, a problem, DMX oftentimes is a solution for finding that thing that no one else can find. So if you've suffered a neck injury, you need to schedule a consultation with us. Click the button below and find out if you have a hidden spinal ligament injury.
Video presentation by Meridian Idaho Car Accident Chiropractic. We dedicate our service to Meridian Idaho auto accident victims who have been in a car collision and have experienced personal injury. Idaho law allows motor vehicle victims to pursue personal injury claims legally, and if you are not at fault, your chiropractic healthcare is covered 100%. The doctors of chiropractic at Meridian Car Accident Chiropractic in Meridian, Idaho, are specially trained to diagnose and treat hidden injuries following a car collision. If you or a loved one has been injured in any type of motor vehicle crash, we are here to help you get your life back on track. We provide clinical, diagnostic and treatment excellence. We accept car crash victims, whiplash injury victims, commercial truck accidents, and motorcycle accident victims. There is no fee for you, your loved ones, and your friends to seek chiropractic care at Meridian Idaho Car Accident Chiropractic. Call now 208-581-4353 and let's get you back on your feet.